Hey folks, this year Fox 13 is teaming up with ACL Healthcare, and we're here with Dr. Thomas Watson, and we're talking about certain injuries that can happen. You are a sports physician, correct?
That's correct.
Folks, by the way, if you have any questions, the number's there on your screen. We have a whole phone bank of wonderful people here taking your calls. The number is 844-744-3258. And Doctor, we're going to talk about ACL injuries, and that involves the knee, correct?
That's correct.
Now, exactly for folks at home who don't understand or don't know anybody who's been through this, what is an ACL injury and how serious can they be?
Well, it's one of the major stabilizing ligaments of the knee, and it prevents the knee from sliding or giving way, having people fall down inadvertently when they don't expect to. Happens, unfortunately, too often. Basketball players, soccer players, we've seen a couple in the World Cup go down with ACL tears already, and it's only been a week.
And it's one of those things, you don't have to be an athlete. Many times people just stand up in a wrong way or sit down in the wrong way, correct?
It can happen to others, stepping in holes, twisting wrong, falling down a couple of steps. It can happen in everybody, though most of our contact or elite level athletes have them more frequently.
Well, let's talk about some preventative measures that people can take. Obviously, the more you strengthen the muscles surrounding the tendon, that's probably a good thing, correct?
That's a great thing. Frequently, injuries or ACL injuries occur in athletes when they're tired, after a lot of activity or after an injury that has weakened the area around it. So yes, many of the things that help people prevent ACL tears are strengthening programs. For females, teaching them to run just a little bit differently, and that can help prevent those types of injuries.
In your profession of sports medicine, what are some of the better ways to prevent as far as exercise are concerned, or perhaps maybe they're the same exercises you would do to recover?
They're very similar, yes. Recovery injuries, strengthening the quads and hamstrings as well as the core are all very important to helping prevent these injuries from occurring.
Do we have any folks in the studio there that are going to be demonstrating a couple of exercises? Do we have that? There we go. Okay. Now, could you maybe describe what these ladies are doing?
Well, they're just working on a hip extension exercise to help strengthen the buttocks and the lower extremity.
And that, of course, tightens up all the muscles surrounding the knee joint and therefore supporting the tendons.
It does.
Now, how many repetitions should somebody do this, and is this better for prevention or is it better for recovery?
It's better for both.
Okay, so if somebody's going to be active, they have an active lifestyle, they're perhaps growing older and they want to protect themselves and they want to watch out for something like this, this is something they should be doing. What other kind of exercises can they do, and what other resources do they have?
Oh, there's lots of resources. They can go to the SportsMed Utah website. That will give them the ability to go and get these activities, these strengthening exercises. And as you've seen earlier today, the rotator cuff, the lower extremity, the quads, the hamstrings, the hips, all those areas can be addressed and can help people prevent injury, not just to their knee, but to their entire body.
Well, Utah is certainly a state where people are outdoors, they are active, they're biking, they're hiking, they're running, they're skiing, probably pretty prevalent around here, so we appreciate the advice, Dr. B. Thomas Watson, for being here of ACL Healthcare, and we thank all of our folks here on the phone banks. It's very busy, as a matter of fact, since we started talking, so keep those calls coming. 844-744-3258. Doctor, again, thank you very much.
Thank you.
Back to you guys.
All right, Dave. Yeah, just to remind people.